Welcome to AI DocuFeed, where we break down complex documents into easy-to-understand podcasts. Today, we're tackling the official Medicare and U 2025 handbook. Be sure to check the show notes for links to FAQs and worksheets you can use to follow along or fill out after the show. Please note, this podcast is for informational purposes only and does not provide financial, medical, or tax advice. Always consult a qualified professional for your specific needs.
Welcome back, everyone. This time, we're going to be taking a deep dive into Medicare Supplement Insurance. It's also known as Medigap, and it can be pretty confusing for, baby boomers approaching retirement. We're using the Medicare and U 2025 guide and, some other resources that we found along the way. But really, the goal here is to give you the confidence to make informed decisions about your healthcare coverage, so you can plan for those retirement years without any, big financial surprises.
That's a great goal because so many people approaching retirement are worried about healthcare costs. And rightfully so. Medicare is a great foundation, but it doesn't cover everything.
Yeah.
And that's where Medigap comes in, to fill those gaps and kind of smooth out the financial bumps in the road.
So let's start with the basics. Original Medicare has deductibles, coinsurance, and copayments. Can you explain those?
Sure. So let's take the Part A deductible for hospital stays, for example. In 2025, you'll need to pay $1,600 for each benefit period before Medicare kicks in. Coinsurance is the percentage you pay for covered services after meeting your deductible. And then copayments are fixed dollar amounts you pay for specific services, like doctor visits.
Gotcha. So even with Medicare, there are still costs. And so Medigap is like an extra layer of protection against those costs.
Medigap plans help cover those leftover costs, making your healthcare expenses more predictable. And for people on a fixed income, that peace of mind is priceless.
Yeah, especially for baby boomers transitioning into retirement. We hear a lot about Plan C and F. What's the deal with those?
So Plan C and F, they used to be very popular because they cover the Part B deductible. However, since January 1st, 2020, they're not available to people newly eligible for Medicare. So if you were already on Medicare before 2020, you might still have those options.
So for those who can't get Plans C or F, what are the alternatives?
Plans D and G are often considered good substitutes, but honestly, the best plan really depends on individual needs and budget. That's why we'll be looking closely at the comparison chart in Medicare and U 2025 later. It breaks down the coverage for each lettered plan.
Okay, and these lettered plans, are they all basically the same regardless of the insurance company?
The plans themselves are standardized. So Plan G, for instance, will offer the same basic benefits whether you buy it from Company A or Company B. But here's the catch. The premiums can vary significantly between companies.
Okay, so you can't just pick a plan based on the letter alone.
Right. It's crucial to compare prices from different insurance companies to ensure you're getting the most value for your money. Don't assume they'll all be the same.
And while we're on the topic of crucial things, let's talk about the Medigap Open Enrollment Period. What is it and why is it so important?
This is a 6-month window that begins the month you turn 65 and are enrolled in Part B.
Okay.
During this time, you have guaranteed issue rights. That means companies can't deny you coverage or charge you higher premiums based on your health history.
So even if you have pre-existing conditions, they can't discriminate against you during this period.
It's your best opportunity to lock in the coverage you need at the best possible price.
But what happens if you miss this window?
You could face higher premiums or even be denied coverage altogether.
Yikes.
It's not a situation you want to find yourself in.
It sounds like that 6-month window is pretty make or break.
It really is. Marking it on your calendar and taking action during that time can save you a lot of headaches and potentially a lot of money down the road.
So let's say you've done your research, compared prices, and found the perfect Medigap plan. Can you then also enroll in a Medicare Advantage plan for extra coverage?
You cannot have both.
Oh.
It's either Medigap to supplement Original Medicare or a Medicare Advantage plan, which is an alternative to Original Medicare.
Ah, I see. So you're essentially choosing one path or the other for your healthcare coverage.
Exactly. They serve different purposes and can't be combined. It's like trying to fit 2 different puzzle pieces into the same spot. They simply won't work together.
So before we dive deeper into those lettered plans and what they actually cover, let's make sure we have the foundation set.
Good idea. Understanding the interplay between original Medicare, its gaps, and how Medigap fills those gaps
Right.
is key to making informed decisions about your coverage.
Now I think we're ready to move on to that Medigap comparison chart and see what each plan offers.
All right, so let's dive into this Medigap comparison chart from Medicare and You 2025. It outlines the key differences between the lettered plans.
Yeah, looking at the chart now, it's clear that some plans offer more coverage than others. So how can our listeners determine what level of coverage is right for them?
Well, I would say start by thinking about your health history and potential needs. If you have a chronic condition that requires frequent doctor visits and expensive medications, a plan with more comprehensive coverage might be worth the higher premium.
That makes sense.
It's about finding that sweet spot between your individual health needs, your budget, and your comfort level with potential out-of-pocket costs.
Okay. The chart highlights coverage for Part A coinsurance, hospital costs, skilled nursing facility care, and Part B coinsurance or co-payments. Can you break down those categories and explain why they matter?
Sure. So let's start with Part A coinsurance, which kicks in after you've exhausted Medicare's coverage for a hospital stay. Some plans, like Plan F, cover 100% of this coinsurance, meaning you wouldn't have to pay anything extra.
Wow. That could be a huge relief, especially for lengthy hospital stays.
Absolutely.
What about those skilled nursing facility costs? I see some plans cover them fully,
Right.
while others only cover a portion.
Skilled nursing facilities provide care after a hospital stay, and those costs can add up quickly.
Yeah.
Plans A, B, C, D, and F offer full coverage for a certain duration, while other plans have copayments or coinsurance.
It sounds like having a plan that covers those costs could be incredibly beneficial, especially for someone recovering from surgery or an illness.
Absolutely. Now let's move on to Part B, which covers things like doctor visits, outpatient services, and durable medical equipment. The chart shows which plans cover the Part B deductible and what percentage of coinsurance or copayments they pick up.
So if a plan covers 100% of Part B coinsurance, you wouldn't have to pay anything for those services after meeting the deductible.
That's correct. It's important to note that not all plans cover the Part B deductible. For example, Plan G, a popular alternative to Plan F, doesn't cover that deductible.
So choosing between Plan F and Plan G could be a big decision,
It could be.
especially for those who anticipate needing a lot of doctor visits or outpatient care.
It could be a difference of hundreds of dollars per year,
Wow.
depending on your healthcare utilization. That's why it's crucial to compare plans side by side to see which option makes the most financial sense for you.
What about those out-of-pocket limits we hear about? Don't some Medigap plans have those?
You're right. Plans K and L stand out. They have annual out-of-pocket limits. This means once you reach a certain spending threshold, the plan covers 100% of your covered costs for the rest of the year.
That could be a game changer for someone worried about catastrophic health events or high healthcare costs.
For sure.
It essentially caps your potential financial risk.
However, it's important to note that plans K and L come with higher coinsurance and copayments for many services. So you're trading lower upfront costs for the security of that out-of-pocket limit.
It's another example of how choosing a Medigap plan involves carefully weighing your individual needs and priorities.
There's no one-size-fits-all answer. Now, while we're looking at this chart, it's important to reiterate that plans C and F are off the table for anyone new to Medicare after January 1st, 2020.
So those boxes on the chart are essentially irrelevant for a large portion of our listeners.
Correct. But the chart still provides a valuable overview of the available options, highlighting key differences in coverage and cost sharing.
And remember, the costs listed on this chart are for 2024. For the most up-to-date pricing in 2025, it's always best to consult Medicare.gov.
Great point. They'll have the most current information on plan availability and premiums in your area. Don't make decisions based on outdated data.
But what about those things Medigap doesn't cover? For example, what about prescription drugs?
Good question. Medigap plans do not cover prescription drugs. If you need prescription drug coverage, you'll need to enroll in a separate Part D plan.
So it's like having two pieces to the puzzle Medigap for covering gaps in original Medicare,
Right.
and Part D for prescription drugs.
That's a great way to think about it. And you can choose to get those pieces from the same insurance company or different ones.
Gotcha. This brings up another important point. Medigap only works with original Medicare, right?
Yes.
you can't use it with a Medicare Advantage plan.
That's right. If you choose a Medicare Advantage plan, you won't need Medigap.
Okay.
Because the Advantage plan functions as an all-in-one alternative to original Medicare. It's a completely different approach to coverage.
So for our listeners who are considering Medicare Advantage, keep in mind that this conversation about Medigap doesn't apply to you.
Exactly. It's one path or the other. And each path has its own set of pros and cons.
And for those who are sticking with original Medicare and considering Medigap, remember that each plan comes with its own monthly premium.
Right. Those premiums can vary widely depending on the plan, the insurance company, and your location. It's not a one-size-fits-all situation.
So what's the best way for our listeners to navigate this complex world of Medigap and find the plan that's truly the best fit for them?
That's a great question. And I think it's the perfect segue into the final part of our deep dive. We'll cover resources, strategies, and key considerations to help you make confident decisions about your healthcare coverage in retirement.
If you've made it this far, chances are you're finding this helpful. Why not share the clarity? Subscribe to the podcast and share it with someone who might need a little Medicare guidance. Let's help more people navigate this together.
Okay, so we've covered a lot of ground today.
We have.
From the basics of Medigap to the nuances of the different plans. It's a lot to digest, especially when you're already juggling, so many other aspects of retirement planning.
Absolutely. But, don't feel overwhelmed.
Right.
There are resources to help you navigate these choices and find the coverage that aligns with your individual needs and budget.
Okay, so let's talk about those resources. Where can our listeners go?
Medicare.gov is an excellent starting point. They have a wealth of information on Medigap, including plan details, costs, and enrollment guidelines. You can even use their Plan Finder tool to compare plans side by side.
Are there any other resources that you recommend?
The State Health Insurance Assistance Program, also known as SHIP, offers free personalized counseling. They can help you understand your options, answer your questions, and guide you through the enrollment process.
Okay, so if someone is feeling lost or overwhelmed, SHIP is a great place to turn.
They're a valuable resource for anyone navigating the complexities of Medicare. And don't forget about that handy booklet, Choosing a Medigap Policy. It's packed with useful information and can be downloaded directly from Medicare.gov.
It sounds like a must-read for anyone considering Medigap. Now, let's shift gears a little bit. What are some key things our listeners should keep in mind when making decisions about their Medigap coverage?
Well, think about your current health status, family history, and healthcare needs in retirement. If you have a chronic condition, prioritize plans that offer robust coverage for those specific services.
So someone with a history of heart disease might want a plan with excellent coverage.
Exactly.
Cardiologists, hospital stays, and prescription drugs.
Absolutely. And consider your budget
Right.
and how much you're comfortable spending on monthly premiums. Remember, premiums can vary widely between plans and insurance companies, so shop around and compare prices carefully.
It's also essential to factor in potential out-of-pocket costs, right?
Yes.
Higher premiums often mean lower out-of-pocket expenses,
Right.
and vice versa.
Exactly. Think about your risk tolerance. Are you comfortable with some financial exposure in exchange for lower premiums? Or do you prefer the security of knowing your costs are capped, even if it means paying more upfront?
Those are all really crucial considerations. It's like customizing your healthcare coverage to fit your unique needs and circumstances.
That's a great way to put it. And don't be afraid to ask for help along the way.
Right.
Medicare can be confusing.
Yeah.
And there's no shame in reaching out to SHIP, Medicare.gov, or even a trusted financial advisor for guidance.
This whole conversation has really highlighted the importance of planning ahead for healthcare costs in retirement.
Absolutely.
It's not something you want to leave to chance.
No.
So as we wrap up our deep dive into Medigap, let's leave our listeners with a final thought-provoking question. Knowing what you know now, how does Medigap fit into your overall retirement plan?
It's an important question to reflect on. Healthcare costs are a significant part of retirement planning, and understanding how Medigap can protect you from financial surprises is essential for enjoying those golden years.
Remember, You're not alone in this journey. There's help available every step of the way.
Thanks for joining us on this exploration of Medigap. We'll see you next time for another deep dive into a topic that matters to you.
Thanks for listening. Don't forget to check the show notes for helpful worksheets and share this episode with someone who needs Medicare clarity. Next time, we'll explore Medicare coverage options, what's included, and how to choose the right plan. See you then.